you're going to be talking about collectivism, the collectivist theory, you're going to want to mention the Beveridge report. Certainly for, as I said, if you're looking at it from a sociology of health and illness or health and social care point of view. Now, the Beveridge report, commissioned in 1942 by Lord Beveridge, and the Beveridge report detailed 5 giant evils that were said to be causing kind of the problems in society. Now, it's interesting from a sociological point of view when we look at these because of the language that was used. So, for example, there was want was one of the 5 giant evils, which we would now call poverty. Squalor, which would be poor housing now. The other one was disease, which we'd still call disease, but ill health. Idleness, which is unemployment. So interestingly, the idea that those that are unemployed were idle, maybe. But again, it is language of the time. And ignorance was the other one, which was inadequate education. Okay, so how are these addressed then? Poverty was addressed through a range of welfare services. So this is where we get unemployment schemes from, family allowance, money if you're made unemployed, so these kinds of things. So that's where we get our now what we know as kind of the welfare state from. Poor housing. So even in post-war Britain, people were living in Victorian houses that hadn't been well maintained by the local councils and the government. So they actually introduced newer council-owned and maintained properties, which were much more modern, up-to-date, newer building regulations, cleaner. Ill health, and this is a really big one. So ill health, the Beveridge report led to the introduction of the National Health Service, or the NHS. Now, we don't actually get the NHS until 1948, but the 1942 report set the wheels in motion, which is quite a major event. So they also dealt with unemployment through what they called labour exchanges, which now we would call like a recruitment agency. So where people could go and talk about what skills they had, and in return, they'd be offered different jobs. And finally, education, secondary education was expanded. So the age, you had to stay at school until you were 15. So from this, we also get the Education Act, which meant that schools were to provide milk, meals for children, medical care. And this is where we get the introduction of the 11 plus exams, which we don't really have time to go into today, but that would decide kind of where you went, which type of school you went to after your 11 plus exam. Okay, just to summarise then, so collectivism is the idea that the individual is less important than kind of the whole group of society, and that a collectivist government would provide a range of services for their people in order to support the most vulnerable in society. So the benefits of this are that it helps the most vulnerable in our society. It offers support for those who need it or when people need it. For example, maternity pay, unemployment benefits, these kinds of things, disability benefit. Which we were talking, the example we used was the Beveridge report and kind of post-war Britain. So it helped build post-war Britain again, get more modern housing, help people that were returning from war to have employment, this kind of thing, with the labour exchanges. And it led, most importantly, to the formation of the NHS in 1948. Okay, so there we go. That's collectivism. As I said, it's from the point of view of more of health and social care, but if you want to read further about collectivism, there's a lot out there where it looks at the actual ideology in more detail.